Hi everybody, welcome to the DogSpot live, and here we are with Unnati. I am Preeti. We're going to be talking about a very interesting topic today, which is of the clinical benefits of animal assisted therapy. Unnati, we'll give it a few minutes. It normally takes around 5-10 minutes for people to get to log on, so maybe we can just talk about a few things while people are getting in. And
Sure.
I think we already have a few. And we have some comments also. Yes, people are logging in. That's great. This is going to be a really interesting session. I've really been looking forward to it. So
Me as
it's such a
well.
pleasure to have you here and talk about this. I think it's a much needed topic. So why don't we get started? So Unnati, why don't you tell us a bit about yourself? Okay, so let me just quickly introduce the topic before we go to that. So, we're going to be talking about the clinical benefits of animal assisted therapy. We're going to be talking about a topic called neuropsychology, and Unnati is going to tell us a little bit more about that and how animal assisted therapy fits into the whole scope of neuropsychology. So, Unnati, why don't you get started? Why don't you tell us a little bit about yourself and what you've been up to?
Hi, Preeti. Firstly, thanks for having me here. Like you rightly mentioned, a much needed topic, something that needs to be discussed on a lot of Indian platforms. And thanks to DogSpot for creating this initiative and getting people to speak about the topic. So, about myself, I'm a psychologist and animal assisted therapist. I am also a former professor from Christ University in the Department of Psychology. I run this initiative called Therapeutic Paws, and this is an initiative that has been up and running for about 2 to 3 years now, but we've had our online presence only recently. So that's a little bit about what I am and what I do.
No, that's amazing. I was really amazed to hear that, about the work that you're doing and that you're doing your PhD in such an interesting topic and such a cool topic. I really, like we said, just before we went live, I hope that there are more people who get into this and, where we can see more information and more research coming out of this. I think what is interesting and what is important to also point out is that we've done a lot in DogSpot has done a lot of sessions also on animal assisted therapy, but then we're looking at it from a very different angle today, right? We're looking at it from a clinical perspective, and we're going to talk about really how it actually affects the brain and how it affects chemicals in the brain and what is the difference. What are the benefits that one can see from it? So it's such an interesting perspective.
Thanks, Preeti. So you're right. When I started out, also I've my training has been in clinical psychology, and I have been a huge animal enthusiast. I've had pets growing up. We've had pets in the house all the time, and I always wanted to have a field and a career where I can combine the two of them. And I realized that there was a field like animal assisted therapy, but not so much in India. So I kind of took it upon myself to be able to combine these aspects, bring the field here also, and be one of the people who can create those opportunities for others who want to learn and engage in this field. So yeah, that's what led to my whole PhD on where I'm looking at the neuropsychological benefits that animal assisted therapy can bring about.
I think that's amazing. Why don't you tell us a bit more about your PhD, about your PhD topic? I mean, it's a really, it's an interesting premise that you're working on, and
Sure.
also you were mentioning that you had presented the pilot of your PhD at New York last year. So, can you tell us a little bit about that, about your PhD topic?
Sure. So, see, whenever we talk about animal assisted therapy or its benefits, we are always relying a lot on Western literature or literature of from countries and people which have a culture very different to us, a mindset very different to us. So naturally, the kind of benefits we gain from it is also going to be different. So one of the things I really want to focus on is bringing that research culture in India as well, where more and more people are studying this subject on our populations, on Indians per se. So my study, so also a lot of studies, they say what they do is they have a group that gets animal assisted therapy. They have a group that does not get any kind of therapy. They compare the results of both and say that animal assisted therapy is, very helpful and beneficial. But what the drawback there is that you're not comparing animal assisted therapy to something. You are looking at it in isolation because you're comparing it to a group which is not even receiving any form of therapy, right? So one thing that my PhD is looking at is that we've got two groups. One group receives therapy along with the presence of an animal, so an animal assisted therapy, and the other group receives therapy but without the presence of the animal. So I am comparing two groups, both of which that receive therapy, only that one has an animal. So when you look at the impact of that particular therapy, you will see that the impact is because of that animal and not because of many other factors that could also play a role if the group was receiving some other form of treatment, right? So they receive the same treatment, one group with a therapy animal, one without. And we're looking at the kind of neuropsychological effects that that has on the participants. So far the findings have shown that there have been better neuropsychological, the aspects of the neuropsychological functioning of the people who've received animal assisted therapy has been much better as compared to the ones who didn't get animal assisted therapy. So like you were mentioning, we had a pilot of this study that we ran last year, and we were invited to the IAHAIO conference in New York to present our findings, and that was one place where we could discuss all of this. And it was a large conference at this beautiful place called Green Chimneys in New York, and we had almost 400 plus practitioners that were there from all over the world, and we were able to present our work there. And we also visited. Sorry.
I said, how incredibly amazing is that?
Thank you. And then
Yeah,
we also.
no. Go ahead. Go ahead. Go ahead. You were
Okay.
saying.
I was saying after that, we also, I mean, in the same trip, we also were invited for a lecture at Miami University where we were able to discuss with their students about how to incorporate animals in research and how the whole process is and what we did with our study.
I'm just so awed. I can't tell you anything. I'm just so completely awed by you and by this topic, and I just think it's incredible what you do. I know I'm kind of repeating myself there, but I have to say it. For people who are just joining us now, we're talking about the clinical benefits of animal-assisted therapy. We already have a bunch of questions, and we will get to them soon. In the meantime, Unnati, let's get on to the next thing. I think that the first question that we're going to ask you to explain to us, because we are all unfortunately laymen. Okay, can you tell us what exactly is neuropsychology?
Okay, so neuropsychology is basically the study of the brain and the nervous system. And we look
Okay,
at how a person's brain and nervous system impacts their behavior, their cognition, the way they are basically, and how that's related to the changes, the different parts of the brain, the different chemical changes in the brain. So neuropsychology relates all of that together. So if there's something wrong with an individual, if they're having some kind of ailments or some troubles, we can directly point out to which parts of the brain might be implicated or what chemicals might be a little off, and then how to target these activities to ensure that there's betterment of those parts of the brain. So the study of their brain, nervous system, and the chemicals in the body.
okay. Thank you so much for that. I think we really needed that. We don't want to confuse anybody. So, okay. Now, moving on to the next thing, tell me, how does AAT or animal assisted therapy actually feature in neuropsychology? I mean, what is the connection in all of this?
Okay. So one of the most common things that I think a lot of animal assisted therapists will cite out there and a lot of animal enthusiasts now know is this chemical that we call this neurotransmitter that we call oxytocin. Now we all know that when we touch an animal, we feel good. And there's whenever we're petting it or interacting with these animals, there's this chemical or a neurotransmitter called oxytocin that is released in our brain. Now, this
Okay.
oxytocin has a variety of implications. It performs a variety of functions. And if you look at the pathways that oxytocin takes in our brain, it's very widespread. So the release of oxytocin further releases and impacts other chemicals and other parts of the brain as well. So that one chemical can impact a lot of parts. Now, the best way to release now oxytocin plays a huge role in creating. It's called a happy hormone. It plays a huge role in making us feel happy, make us feel like we're bonding. It plays a huge role in relationships, apart from a lot of other clinical implications that it has, like socialization, eye hand coordination, a lot of other things also that it does for us. Now, one of the easiest way to release this oxytocin is positive physical contact. That means if I'm having a positive physical contact with an animal, that is where the animal also desires that kind of contact, and where, say, I'm petting my dog or I'm hugging my dog, that will release oxytocin. And the best way to release oxytocin is that touch. Now, skin being the largest organ of our body, the minute you hug a dog, there's so much of it released that you can imagine the kind of impact that might have. And a lot of
Yeah,
recent studies are going on to show that this oxytocin is also released in the animals. So the animals also have that surge of oxytocin where they also feel happy, and they also get a lot out of that bond, not just the humans.
so it's a
So
two-way street. Yeah,
it
it
is.
works
It
for
is
both. It works for the human being as well as for the animal. I mean, we're talking about the same kind
absolutely.
of chemical changes that are happening in both the animal brain as well as the human brain. That's amazing. Okay.
Absolutely. So now, if that touch with an animal can release oxytocin, you can only imagine if I have a goal-oriented structure animal-assisted therapy session with a person where I'm targeting the specific ailments that they have. You can only imagine the kind of effects that that will have if a mere touch of a pet or a street animal or anyone or somebody else's pet can create this kind of an impact. So that's
Yes.
how animal-assisted therapy fits into neuropsychology.
That's amazing. That's really, really amazing. I mean, it's such an interesting perspective, right? I mean, when we talk about dogs, when we talk about living with them, when we talk about spending time with them, or even meeting a dog on the street, we know inherently that it gives us pleasure. But then to actually be able to say that this is how it works, I think is
Mhm.
really an interesting perspective on this. So, tell me, let's just move a little bit, and let's do a little bit of a deep dive into this. You were talking about the kind of disorders that, how it can affect and help with so many disorders. Can you tell us a little bit, just, for us to understand, what are the kind of disorders maybe that can be treated with animal assisted therapy? And, what
Okay.
kind of impact have you seen?
Okay. So Preeti, the way I'll approach this question is first I'll tell you about a few very common prevalent disorders that a majority of us might be seeing around us, and followed by that I'll break it down into all the other disorders and how exactly animal assisted therapy helps with those disorders. Now, let's look at the most prevalent ones that we've all heard about also, that is depression and your entire anxiety spectrum, all the types of anxiety disorders that you have. Now, depression
Right.
is really prevalent. I mean, recent studies by NIMHANS, some of the largest organizations in India that focus on mental health, for example, NIMHANS, has said that 1 in 20 people suffer from depression. Now, that is quite prevalent. A lot of people are suffering from these disorders. Similarly, if you look at anxiety, the prevalence rate is quite high. It's about almost 20. Prevalence rate is 20 points so and so percentage. So that's almost more than 20 people per 100 that suffer from some kind of anxiety disorders. So that's a lot of people suffering from these issues and a lot of them might not be, clinically diagnosed. They might be facing symptoms of it and not know
Right.
that there are these disorders. So the
Right.
way that I always ask my students, my interns, and everyone to approach these disorders is not to look at how is animal assisted therapy directly impacting the disorder. You have to break
Okay.
the disorder down into its aspects or its symptoms. So, for example, depression will have a lot of symptoms, like the person will start isolating, they'll have sleep or appetite issues, they might have loss of pleasure, feeling sad. If you look at these symptoms, each of them can be directly targeted with animal assisted therapy, and we can create improvement. So each of the sessions that we have, we structure our activities or sessions in such a way that it impacts these particular aspects. And once the person starts seeing improvement in the sub aspects, they will start feeling better overall. So the disorders have to be broken down in terms of their symptoms or the kind of ailments that present itself. And if you're
Okay.
looking at some common symptoms, say difficulty in communication, difficulty in relationships, you'll see that these symptoms fall under a lot of disorders. So even if you talk about personality disorders, you will see a lot of them having trouble with communication or trouble with relationships. And that's something that animal assisted therapy can help with. So similarly, if you're talking about children, if they have autism, they're going to have difficulties with empathy, with the eye contact. All of these are things that animal assisted therapy, when you break it down in terms of symptoms, you can create activities and target these symptoms directly, which in turn overall helps the entire disorder itself.
So I have one question over here. So in this case, are you specifically talking about dogs? Are you talking about how animal assisted therapy only with dogs, or are you talking about the entire range or different species of animals?
That's a great question, Preeti, and that's something we hear quite often also. So I'm not talking only about dogs. Animal assisted therapy on the whole can help a variety of conditions. However, the choice of animal is very important depending on the ailment that the person comes with. Now, when a client comes to me and they tell me about the ailments, that the troubles that they are having, based on that, I will be able to figure out which animal is better suited for them based on the symptoms that they are telling me about. So it depends on what types of troubles that they're coming with.
So, also the reason that I asked this question, I mean, this is a little bit from personal experience, is that my younger daughter goes for equine therapy, and I have noticed that it actually affects her speech. That is, it makes her speech better. So, the point that you're making about working with different animals for different things and working on different symptoms, I think is extremely relevant. Like Arya she works with dogs for a completely different thing, to do a different set of things, but she works with the horses to do a different set of things. So I think that's like a really interesting point, right? And of course, there are so many animals that are used for emotional therapy. There is all of that, right? There is such a big list, and there is so many ways to kind of break this down, and there are so many areas in which you can actually use therapy animals, and so many different ways in which we can use it. And what I was going to say about emotional is that I think what most people are aware of is the emotional aspect, right? Where dogs are being used as emotional therapy, or any animal for that matter is being used as an emotional therapy animal. I think that's kind of become this,
Correct.
catchphrase world over. But what we're talking about is, I think, a lot more serious than that, right? In terms of the fact
True.
that we can address very, very, very specific, maybe clinical issues or symptoms with animal assisted therapy. So
Very
I think that's incredible. Do you have any cases? I mean, I know that this is I just can't help myself. I have to ask. Do you have any cases that you could demonstrate with, to us? But has it really affected? Have you seen benefits? Have you actually seen changes? I understand, of course, that there is confidentiality in all of this, but I think just to kind of explain or to demonstrate how animal assisted therapy can actually make a difference, maybe you could explain some cases to us, some case studies.
Absolutely. So, yeah, like you very rightly mentioned, in terms of confidentiality, I will not be using names or actual incidents from the case itself, but I'll be using certain examples that we will say in our training sessions and all also, which will help, and some reference to the cases while keeping all the identifiers confidential.
Awesome. Thank you
So,
for doing that.
so yeah, like you rightly mentioned, there are different animals. So I can give examples of two, three different scenarios with different animals involved, so that and very quick examples, so that you can see how the needs were different and there were different outcomes from it. Now, if you are say, like you very rightly mentioned about emotions. Now, even when we talk about emotions, how are these emotional changes happening? These are happening because as a result of the chemical changes that happen in our brain. So what we do
Right.
is we try to structure our sessions in a way that we encourage or we promote that chemical release in your brain, so that and we know what kind of activities will target which parts of the brain, so that we bring about these emotional changes. So in such cases, I mean, depending again on what exactly the client has come with, we could suggest something like being able to have sessions with dogs. However, if there are some gait related, or like you mentioned for your daughter, it's been helping such kind of issues, you would recommend going for equine assisted therapy or for horses, that is. We've had cases where I know of therapists and some of my collaborators, they also incorporate a lot of birds and other animals into their sessions. So birds are particularly interesting to use if you want to include them in some kind of metaphors or stories. So one myth that is there is that when you're doing animal assisted therapy, the animal has to be physically involved in the task. It's not always true. The animal can also be involved in so many other ways, which include stories, metaphors, or talking to or about the animal. And like you mentioned earlier about the speech getting better, people have found this change where they find it easier to speak to or about an animal rather than speaking to a human being. So even if I were to say that, Preeti, what do you think my dog, this therapy dog, is currently thinking? You will be able to project your own emotions onto that animal, to be able, and when you speak about what that animal is thinking, you will be projecting a lot of what you are thinking onto that animal. So there are so many techniques and ways of including animals. Now, one example is that a lot of time you have fish or fish tanks or aquariums that are set up in houses of people who have some kind of heart ailments, so some kind of cardiovascular coronary heart diseases that they have. Fish tanks really help a lot because depending on the nature of the issue that the person has, there are different kinds of fish that are recommended for them. And the structured interventions that would be taking place would be how they will engage with this aquarium, how will they look at it, what are the activities they do while watching this fish, which has significantly shown to change their heart rate and the way that the heart functions. So a lot of and this I'm talking from scientific research, not just anecdotes. And a lot of this has also been proven through a lot of scientific research. There's this one particular case that's very close to my heart, where there was this little boy who just didn't open up. He was going through a lot of difficulties in school and showing a lot of behavioral symptoms that are very unruly behavior. And he was just not opening up to whatever therapist they took him to talk therapist, to psychiatrist. He refused to open up and speak. And he was with an animal assisted therapist, and he just sat back there and he saw the therapist with a lot of animals around. So there were dogs, cats, birds, and he just saw the therapist interacting with these animals. And
Okay.
the first session was just that we didn't nobody spoke to the boy. They were just interacting with animals. And over time they saw the boy started speaking. And over a couple of sessions he started feeling better. There were behavioral changes, and the boy just made a whole miraculous u-turn in his journey, and he started feeling a lot better. So after the sessions were over, the parents sat back and reflected, and they went to the therapist. They got the boy together and they discussed with him that what made you speak. You weren't speaking to all these therapists we took you to. Last resort was the animal assisted therapist, and you spoke. And the beautiful thing he said was that when I saw the therapist interacting with the animals, I saw the way the animals trusted the therapist. They just jumped into the lap or let the therapist do whatever. I knew that I could trust the therapist as well. And the whole presence of the animal itself made me feel so comfortable, and that I could trust this therapist and speak to her. And that's how the boy even decided to open up in the first place. So that you might not always see some direct impact, but there are so many underlying chemical changes and impacts on your brain that's happening, that you can only see over time and when you start seeing these behavioral changes. So a lot of ways that these interventions can impact a person.
What you brought up is such an interesting thing, right? It's the concept of trust. I think also one of the things, I mean, I'm just associating it to what we maybe talk about or see, that, one of the things that we all say is that, if this dog people are kind people, dog people are nice people, right? We tend to say these kind of things. It's just one of those statements that one makes. But then I think this in some way maybe demonstrates the fact that when an animal is able to trust you, it shows maybe a certain level of openness about you, about your personality, about the way, and makes it also easier for the people around. I think that is so cool. That is such an interesting one. I mean, that is just amazing. And you were a part of this therapy.
I was associated, yes, with it. So
You were
it was a team
associated.
that was working together. Yeah. There's in fact another very beautiful case, but now that you're speaking of trust, it comes to mind. Again, quickly, I'll tell you about this case. So
Hello.
this girl, so this girl, she was going through some issues, and they were all trying to work on those issues, but she was still, they were not able to reach that root cause of what was causing some kind of behavioral issues that she was having. Again, a little girl that we're talking about. And the therapist removes the bird from the cage, and just to have some kind of storytelling, some kind of activities. And while she was removing the bird on her hand, she kept her hand over the bird so that the top of the cage doesn't hurt the bird. And there were some issues that the girl had never spoken about, but in the presence of even a bird. So why I'm bringing this case in is because we need to realize that we can incorporate a lot more animals, not just the regular ones we know about, dogs and horses. She saw the therapist removing the bird, and she said, why are you keeping your hand on top of the bird? So she said, so that the bird doesn't get hurt. The girl's like, okay, now I understand why XYZ has been putting their hand on me. And they were all confused, and we tried to explore further. But with the presence of that animal, the girl was comfortable to be able to reveal an entire case of abuse that came to light where because she could relate it with the bird and she felt comfortable and she could open up about it. So this was something that nobody knew. I mean, it was just not spoken of till this incident happened.
That's amazing, right? I mean, it's just amazing what animals can do for us. Unnati, I'm just going to quickly take a look at the kind of questions we're getting. A lot of questions.
Sure.
I think a lot of the questions are also centered around, how can I train my dog to be a therapy dog? How do I know whether my dog can be a therapy dog? Guys, Malvika, and I think there was somebody who asked that question earlier also. Just hold on for a little bit, and towards the second half of this session, we will answer that question. We will definitely go there. Of course, that's something that we all want to know for sure. So we'll get there. Just hold on for a little bit. Now, the other interesting thing that you had mentioned when we were talking in our sessions, in our conversations before this live session, is you were talking about the impact of that animal assisted therapy has on immunity. And that sounds really, really interesting. Can you tell us more about that?
Sure. So recently, my PhD guide, well, and I and a couple of my collaborators, we've been working on this concept called as psychoneuroimmunology. So we've recently written a chapter for a book on psychoneuroimmunology, and our chapter focused on how animal-assisted therapy impacts this entire concept. Now, if you break this concept down into the three words that make it up, it's psycho, neuro, and immunology, meaning how the mind, our psychological aspects, our neurological aspects impacts our immunity. So when we are looking at animal assisted therapy also, we again, like I mentioned earlier, that instead of looking at it how animal assisted therapy directly impacts immunity or directly impacts any disorder or deficiencies in immunity, we need to break it down and look at what mediates between animal assisted therapy and immunity. Now, we know there are a lot of psychological aspects and neurological aspects, so different changes of chemicals in our brain, as well as certain psychological aspects like our stress that we go through, which directly impacts our immunity. So, this entire concept talks about how animal assisted therapy can be used with structured activities that focus and target on these issues that people are having. So, say, for example, they're undergoing some kind of stress, how animal assisted activity then impacts the chemical that's responsible for stress. So, for example, cortisol is the chemical that impacts stress in people, and animal assisted therapy reduces that cortisol level, which reduces stress and hence impacts the person's immunity. So similarly, there are a lot of chemicals. I won't go into the details, but a lot of chemicals and a lot of brain pathways. There's something we call as the HPA axis. A lot of these pathways that are impacted by these structured animal-assisted therapy activities, which in turn has its impact on immunity. So, in fact, there are a lot of interesting large scale studies of over 30 to 40,000 participants, large scale surveys that are done that have shown that people who have been a part of such interventions and activities for over a year, they had in a year, they had lesser hospital visits, lesser costs related to health concerns, and better overall health as compared to people who were not a part of such interventions. So, there are even these large
Wow.
scale studies that prove that.
That's really a large study, right? I mean, that has some
Yeah,
serious scientific basis. You're saying 30 to 40,000 people, that's a lot. So this is not just talk
correct.
in the air. This is something very, very clear cut that has been proven, that has been scientifically researched, checked, and proven. We have some
Yeah.
comments. One, Rana says that happy people live longer. Of course. I mean, of course, happy people live longer. And those of us who have the privilege of, I think, interacting with the animals and being able to do something like this, are very happy. How can we deny that? Totally. Balvika is also saying that every school must incorporate AAT. Totally agree there. What do you think about that, Unnati? I think that's such a valid point, right? I mean, if we're able to incorporate something like AAT within schools, it could have such a huge impact on the children, right?
Absolutely. That's something, in fact, we're trying to push towards, and we are getting a lot of people who are now open to incorporating animals into their settings, even special needs schools, not just, I mean, even regular schools and special needs schools, both will really, really benefit from that. In fact, another book that we're working on talks about AAT in school, combining it with school psychology. And it has such a tremendous impact on the communication skills, on the development of healthy relationships, bonds, the way that they learn how to socialize. All of these have such a huge impact on the children when animals are involved in their life in a structured way, especially in schools as well. So it's something which is I highly recommend and want people to start exploring.
Yeah, I think also that in India, our schools still need to get there, right? I mean, when it comes to animals itself, uh, there are so many roadblocks that one is facing over there. So to expect that a school
True.
is going to be able to bring in animals and have them there as part of their curriculum, they also have to kind of deal with all the parents. And there's still, I think, from a traditional perspective, unfortunately still a lot of roadblocks there, but it's getting a lot better. Today there are a lot
That's
of
great.
alternative schools that are bringing in animals, that are exposing children to a very different range of things, maybe from what somebody like me grew up with, in a very, very regular education where none of this was in any way part of it. Okay, so
True.
the next question that I have for you is that what are the long-term benefits of animal-assisted therapy? Now, you've talked about animal-assisted therapy as a therapy, right? So tell me, the studies that you're doing are about how animal-assisted therapy is helping people. We're treating certain symptoms, but is it how long does the effect or the benefit of this therapy last? So if I have an animal-assisted therapy session today, okay, how long is this really going to impact me, or how is it going to affect my symptoms? Is it something that I need to do over an extended period of time? Can you kind of explain to us how this whole process works?
Sure. So your therapy sessions itself will depend on the severity of the problems that you are coming with. So if you are someone who's having ailments that are very severe, in that case, the professional that you're working with will be able to tell you that you might require an extended number of sessions, not just 4 or 5 sessions that will show you changes. So it's not like a magic. Like a lot of people, expect that they have one session and they'll immediately start seeing changes, but that's not how it works. It does require a certain number of sessions. If you are someone who's coming with very low severity issues, maybe some mild stress, mild depressive symptoms, then yes, the professional may be able to tell you that over the next 4 to 5 sessions or sittings, you will start feeling better. But with high severity symptoms where you require some kind of, say, personality restructuring, or you're going to delve somewhere into the person's past and work on, say, their relationships, stuff like this requires more amount of sessions, and can be determined once you start setting your goals with your professional about what you're trying to achieve out of that session. You will be able to figure out how many sessions it lasts for. So that's a little bit on how many sessions are even required in the first place for you to start seeing changes. Now, of course, you're
Right.
saying that we have these research studies where we look at the kind of impact it has, and we collect our data right after the sessions are over, say a week or two or a month after, and we see benefits. However, a lot of studies, again, like I was mentioning, a lot of studies in the West are also looking at long-term benefits. That is, they go and they test the same two populations, and we're doing that for my PhD as well, where I talked about two groups. One's receiving animal-assisted therapy, one isn't. We test them right after the study's over, but we also test them again after, say, 3 months, after 6 months, at different durations to see if those effects have lasted. Now, a lot of literature has shown that animal assisted therapy does create long term impact as well, not just short term effects, it's also long term. So,
Okay. So that's really to say, is it stretching the point to say that therapy that includes AAT is more effective? Am I overstating, understating? What would you say? I mean, isn't
okay.
that's the basis of your thesis, right?
Yes. So my thesis is showing that the presence of a therapy animal as opposed to therapy without an animal, the presence shows better outcomes. And you will find a lot of literature that also shows. Let's keep therapy aside. Let's not talk about animal assisted therapy. Let's talk about any regular therapy with just the presence of an animal. Animal is not even getting involved in the therapy. Okay, it's just a dog sitting in the room when I'm giving you therapy, as opposed to me giving someone else therapy and no dog. We will see more positive outcomes in your room as compared to the other person, even though you both are receiving the same therapy. And in your room, the animal is present, in the other room, the animal is not. So, even something as simple as
Wow.
that, research has shown that the presence of an animal itself shows more positive outcomes. which is why it's so recommended that a lot of universities should now start opening up to having the animal present in the class. You don't need to know how to incorporate that animal in your education. I mean, of course, if you want to, then you need to get qualified. But if you are not and you're having the presence of a therapy animal also, even that you will start seeing so much better outcome, so much more positive outcome as compared to no therapy animals. So I would say you're not overstating it. That's stating it very rightly.
But that's amazing. I mean, I wouldn't have thought of it that way at all. It's what you also mentioned earlier, which is that it's not necessarily the active participation of the animal that matters, but the presence of the animal. I don't think that any of us have ever really thought about it that way, right? We always think about it as being a very one-on-one. I am talking to the dog. I am actually doing something with the dog. But to say that just the presence of the dog or the animal in the room itself is, I think that's really amazing. Now there is, of course, another question that comes in when you talk about animal-assisted therapy. Let's say that I'm undergoing therapy, and there is a particular dog that is maybe a part of those part of those sessions. Does the patient develop a dependency on the dog? And you know how it is, right? Now animals don't live as long as the human beings do. They do age faster. It could be any number of things. The dog could be ill, unable to attend sessions. The person who has the dog, or the pet parent may move out. Death is unfortunately a definite possibility. Now, how does that impact the person who's undergoing the therapy?
Okay, so that's a very good question. That's a major concern that a lot of clients have when they're starting off with this therapy. Also, specifically, there are a lot of concerns related to their children and the children developing that dependency, and then what happens, if the session suddenly stop one day. So, Preeti, this is a larger topic that applies not only, in fact, to animal-assisted therapy, but to therapy in general, where there is dependency that can happen onto the therapist as well as dependency on the animal. So, how do we deal with that dependency? Theoretically speaking, I'll come to the practical aspect also, which is more relatable and applicable. But theoretically speaking, the kind of bond that is formed between a dog or an animal and the client is not a true bond. So if you look at the theoretical definition of what a true bond is, and when you look at the bond that is formed between the animal and the client, it's not a true bond. So that's your theory supporting the fact that it's not forming the kind of dependency that a true bond would have. However, if you look
Okay.
at the practical aspect, this bond or this dependency, the whole aspect of termination is something that as professionals it's brought on very early into the sessions itself. So say after the first session, basically after we develop that rapport, that relationship with the client, where we are comfortable to bring in this topic, the whole topic of termination has to be discussed, wherein the client will know for sure that this session is going to come to an end as soon as I've met so and so goals, or at the end. So, like I mentioned earlier, if there are less severity symptoms, you know that there are only 5 sessions. Termination is discussed very early into the session so that they are aware that the sessions are going to end after 5 sessions. So
Right.
discussing that point and having that communication channel open, wherein the client can also speak about their concerns and you speak to them about what the whole aspect is. It really helps when it comes to actually bringing the sessions to an end. It helps them process. And another thing is, when any relationship ends, with the animal, without the animal, with the therapist, and the end of any relationship leads to certain amount of grief or certain amount of sadness, or feelings bad that bond is ending, that relationship is ending.
There's an
Having a last
emptiness.
session. True, true. So having that last session where you are keeping that communication channel open and addressing the loss that everyone is going to face, because even as therapists, we feel that loss when our client leaves. So it's something that happens both ways, not just for the client. So discussing that grief at the end of the session is also something that's very important. So two things: discussing termination in the beginning and discussing that loss towards the end. That helps with the.
There are a couple more questions that have come up. Let me just quickly take a look at them. Do the animals? So there are some questions on how it affects the animal. Mona Lisa has asked, "What is the impact on the animal?" We'll just get to that too. These are working dogs. Yes, of course. Also, Malvika has a point when we were talking about stress. This is Mumbai Airport. Let me put this up. Mumbai Air. Let me just put the comment up. Did it come up?
Yes.
Can you see? Okay, so Mumbai airport has therapy dogs for reducing the stress of travelers. And does it stress the dogs out when there are so many travelers, from such a busy airport? And how fair is it to the dog? I guess Malvika, that's again a long answer. Unnati, would you like to take that up?
Sure, I'll give a shorter answer for that. As professionals, we ensure that we are looking at the stress markers in our animals as well. So, for me personally, I ensure that my animals are not undergoing any kind of stress. And in fact, you have to be that's why you need to be trained, qualified, and very well aware of the behavior and the signals that the animal shows to you as well. So, when we are involving animals in such activities, we ensure to look out for stress markers. The minute the animal is stressed, they are taken away from that stressful situation to ensure that there is nothing negative happening to the animal. So, Malvika, to answer directly your question, yes, it can be stressful for the dogs. However, the handlers who are there, the animal handlers who are present, have to ensure that they're noticing these stress markers and taking the dogs out of that situation the minute they are stressed. So looking out for those markers are very important. That's a short version to the question.
I guess that talks to the bond between between the handler and the dog also, right? Which is why the training
Yes,
is such a big deal. And not just the training of the animal, but I think also the training of the therapist themselves or the person of the handler, right? I think
that's
that would be such a key component of this entire process. Mona Lisa had a very similar question, which is why I put it up there, which is what is the impact on the animal for such therapies, because essentially they are working dogs. So I think you already answered that question. So now
I
let's
like
move.
to add one thing here, Preeti. Your
Yeah.
question earlier spoke about dependencies, and then you said that death is inevitable. We didn't. I feel like I didn't answer the death part of it.
Okay.
Yes, sometimes some things might lead to the death of the animal, but however, I also want to make it clear to everyone who's watching that these animals also have a retirement age. They are not worked till they pass away. So they depending on, again, there are different worldviews present, and different therapists will have different ideologies and perspectives towards this, but there is a certain age after which it's not recommended that animals continue to work, and they move on from being a service animal or a service dog to their retirement phase where they can be with the family. So in that case, you are not working them till they pass away or they reach that stage, because they're too old to be working at that time.
That's a very fair point. Yeah. That makes a lot of sense, right? So moving on. Now tell me, is animal assisted therapy a standalone treatment? Or do you work in conjunction with other kinds of therapies?
Okay.
Do you work with other therapists or other experts in different fields? How does it work?
Okay, so animal assisted therapy as of now in India has been looked at as an adjunct therapy. So something that you do alongside some other form of treatment, because till now a lot of people are not aware of the kind of effectiveness that animal assisted therapy has. However, slowly people are beginning to choose this as their primary choice of therapy over talk therapy or any other form of therapy. So it is becoming a primary therapy as well. However, it doesn't work only as a standalone therapy. Animal assisted therapy can completely be incorporated with other forms of treatments depending on the kind of ailments that the person is having. So if there's somebody who has some high severity disorder, in that case they would probably also be visiting a psychiatrist, receiving some medications along with getting animal assisted therapy. So animal assisted therapy is going to help them manage so many symptoms that come under that disorder, which will help them further manage the disorder better. However, it can be used in conjunction with other forms of treatment, say some kind of physiotherapy, or you could have speech therapists that are involved. And it functions very well with other therapies that are aiming at the other ailments that the person has as well.
Right. Okay. So, Feb, the next thing that I think everybody wants to know, and a lot of people I would be interested in, is can all dogs become therapy dogs?
All right.
Isn't
So
that what we all want to know? That everybody's dog is a therapy dog. For us, of course, I think as individuals, for us, our dogs in our homes, they are therapy for us, right? They are. But when we're talking about animal assisted therapy, we're talking about a very specific kind of job and a very specific requirement. Now, tell me, can all dogs really be? What is your opinion? Do you think that all dogs can be therapy dogs?
okay, so I feel all dogs can be therapy dogs, yes, but there's a huge but. So they can be therapy dogs, but they need to match a certain criteria for them to be qualified as a therapy dog. Now,
Right.
yes, definitely there are some dogs that are better suited, some breeds that are better suited to become therapy dogs, but that's because of the entire the whole evolutionary perspective. They were bred to be, companion animals. They were bred to perform that role in a human's life, which is why they are more easily trainable, and they are more often even used as therapy dogs. If you look at your retrievers, your labradors, they are more incorporated nowadays by therapists because they are easier to train and work with. However, that doesn't change the fact that the other breeds can also be very good therapy dogs, provided they are trained. They might take a little longer to train than these breeds that I mentioned, and provided they meet an evaluation criteria. Now, this criteria itself has a lot of things that you look at, like you look at their basic obedience training, you look at their socialization skills, you look at a lot of these things, and most importantly, their temperament. So their whole past experiences, the kind of background that they come from, all of this about the animal is very important before you decide if it can be a therapy dog or not. So in fact, this evaluation begins from the whole puppy stage only, picking the right puppy from the litter. From that's when you can start gauging if there will be a dog better suited to be a therapy dog, and then you keep training them, and at 1 year of age you can evaluate them and gauge if they can be a good therapy dog.
There's a lot of research that goes into this, right? You would look at the puppy, look at them as puppies, you look at the parents, you look at
True.
multiple, look at the entire ancestry and evaluate
Very true.
quite high up the ladder, right, to figure out whether it can work. So that doesn't exclude any dog, but then, like you said, is a very very
Very.
stringent test.
That's
So
a good point you mentioned, Preeti, about the ancestry. So a lot of dogs, in fact, so if I'm picking a puppy whose parents have gone through some kind of neglect or trauma, it's very likely that the puppy could inherit some of these negative traits as well. So looking, like you mentioned, it's very rightly mentioned that you have to look at. So there are a lot of things that are involved when you are choosing a therapy dog, not just the breed. So even though I might have a Labrador, it can fail that evaluation. It can be that the dog won't qualify to be a therapy dog, even though I'm saying that that's a breed that's better suited. So these
yeah.
evaluations are what matter, not just the breed.
And I think it's so important to understand this, right? You're working with people who have problems, right? Who have disorders, and things can go so easily wrong if you're bringing the animal in to make a difference, and it could very, very easily go the other way if this entire situation is not handled carefully. There is a lot of this also depends on the dog at that point of time. So important to be careful about this, right?
That's true.
Okay, so can you also tell us what does it take for a dog to actually? We've discussed part of it in terms of this. Can you tell us a little bit about the kind of training that they undergo? Now, like you said, this is there is ancestry that is looked at. There is the actual the dog is evaluated right from puppyhood to up to a year's up to a year. But what age does training start really, and how long can the training actually take?
Okay, so from my perspective on this is the training begins from the day you get the puppy home. There's no one age that you have to wait till before you start training the puppy. So picking the right puppy from the litter, from the minute it enters your home, the training begins. Of course, when you're picking and
I have to ask over there. Does it not start at the breeder's place itself? Does it not start, the first few weeks of the experience that the puppy has and the mother's experiences which are being passed on to the puppy? Does the breeder not play a part in this at all?
absolutely does. In fact, the breeder also plays a huge role in the way that the puppy is kept there and the experience that the puppy is having there, because that also can impact the way the puppy perceives its environment and the way that it responds to certain triggers. So yes, the breeder also plays a role in ensuring that the whole place has been kept very conducive for the puppy to, grow right.
Right. So
Yeah.
I'm
So
sorry. I know you have a lot more to say on this. I had to interject there.
no, absolutely,
You
that was a
were
very
telling
good point.
us, yeah, you were telling
Right.
us about the training and how it works. Yes.
Yeah, so no, but that was a great point. It begins from that moment itself. But when it comes to the individual who's now owning, who's the pet parent, it begins from the moment they enter the house itself, because a lot of people feel that they should wait for the puppy to become 1 month or 2 months of age before they begin training. But that's not right. It needs to begin from the moment it enters your house, because it needs to understand what are the kind of rules that you follow, what exactly is it supposed to do. If there is a situation that comes about, the puppy needs to know what you're expecting of the puppy to do, and start adjusting to those expectations that you have and learn about it. Now, yes, we spoke about the kind of past experiences and the ancestry that you look at for that puppy. After which you start training it. Training involves a lot of things like your basic obedience training. Now, obedience training involves a lot of your things of being able to walk on a leash, being able to, of course, the basic commands that we know of: sit, stand, down, paw, all of those things. One thing that I love to focus on when it comes to obedience is the word focus itself. How the dog's focus is very, very important. No matter what the scenario is, the dog should know when and how to focus onto you. So I'll give an example here. We were conducting this one very huge workshop, and there were over 150 psychology students sitting in that hall. And it was one of those halls which has the desks on a gradient. So as you look at the class, one student becomes higher than the other because the class was on
Right,
that
right.
gradient. So
Slider kind of thing.
yeah. So when the dog enters, for him, it's like a huge, a whole wall full of people right there, like 150 people sitting in front of him. And we took him in. Oh, this is one of my therapy dogs. His name is Max, and we took him in for that session. And even though the students were told not to altogether, approach or react, it's natural, the students, after all, they all stood up and they were like, "Oh my God, dog! I want to touch the dog," and all of that. And a dog who didn't have that focus, wasn't trained, would react. It would either run away from the situation, it would flee the situation because it would frighten him, 150 people suddenly standing and making noise in front of him, or he would
Yeah.
freeze in the place and not know what to do. Or you'll also find a lot of dogs that would immediately attack, bite, or bark someone around them, because depending on the way that they feel they need to respond to that situation. However, for Max here, the training in focus was done so well, and his focus is so very important, because the minute that happened, he moved his focus from this triggering situation that was really making him anxious and nervous, to me. So you could see that he clearly moved his eyes from that situation to me, to look to me for the next steps of what am I supposed to do. I am confused, I am worried and nervous with these people in front of me. Tell me, what am I supposed to do in this situation? And that whole shift of focus was such a big step. And that way I could immediately bring the whole situation under control. I have not endangered any of my clients or any students nearby. The dog is not fleeing, he's moving his focus onto me. So that in obedience training, one thing that I love to bring up always is the focus of the animal. That's very, very important. So many times, like some of our international workshops also, when he's engaging with some of our participants, the minute I call out his name, he knows that he has to drop whatever he's doing and focus onto me for the next command. And Preeti, this is really important when you're working with clinical conditions, because you're going to have, I mean, the kind of obedience and training that these guys require is because you're going to have situations where children might not know what I'm supposed to touch, what I'm not supposed to touch. They might pull onto the dog, on the fur, touch its private parts, and the dog should not react. It should know how to respond. And if it's getting confused about how to respond, its focus needs to move to you, and it needs to have that bond with you, to trust you to take over and make that situation better for him, make him comfortable in that situation. So these are some aspects that we really encourage to be
I
trained
think
on.
there could even be situations where children or people may not be in complete control of themselves, right? I mean, let's talk about
True,
maybe an autistic child who doesn't like to be touched, who might, kind of get really, really hasty. Now, when there is that kind of movement, it can really trigger the dog. So you need
true,
to have a dog that is very desensitized to all of these things, that kind of knows how to
true.
handle and picks up cues from people very well. So it's the personality and it's the training. What are the other things? Can you tell us that you look for when you are training the
So
dog? I mean, what are the other kinds of training that the dog has to undergo?
for testing, yes, the personality, the temperament is very important. For training, the next thing that is very important is socialization. Now, socialization does not involve only just taking. I mean, it does involve to an extent being comfortable in public, in front of people, in different scenarios, but it's not limited to that. You have to start training the dog and preparing the dog to respond in novel situations also. That's where the whole aspect of obedience and focus mixes with your socialization training to ensure that the dog is ready to respond in certain situations. So, say for example, I was to take Max, a therapy dog, to a hospital, and somebody approaches him on a wheelchair. Now, no matter how much I'm training him in the house, I can't train him to face a wheelchair. I don't have a wheelchair at home. But having that kind of exposure is so important, that kind of socialization, depending on which scenario you're going to involve your therapy dog in. Now, if my dog is never going to go to a hospital, it's still okay for me to not have that particular training in place. But depending on where your dog is going to be fitting in, is it a school? Are you going to be incorporating in some organizations or some corporates? Depending on where they are, they have to be trained accordingly. Also, novel situations, like, say, let's go back to the example of the hospital. Now, if there's somebody walking on crutches and happens to drop a crutch onto my dog's tail, or say I'm conducting a workshop in a restaurant and one of the participants by mistake accidentally steps on the tail of my dog. Now, these are situations, no matter how much you train, you will not do that to your dog physically to train it, right? So these are novel situations that might come up. That's where the dog's focus, the training, obedience, socialization, all of that comes into the picture for them to know how to respond in that kind of a situation. So these are things that you continuously keep training them in. Of course, you have your whole special tricks and all also that you can teach them, again, depending on the kind of population you'll work with, because that's worked wonderfully well for me, where we've had groups that that don't interact. If we're doing a group therapy session or with an individual that seem to be kind of quiet and not opening up, that's where all your tricks and all come into the picture, and you can
Icebreaker.
make it. Sorry.
Yeah, it's an icebreaker.
It's an icebreaker, definitely. So,
Yeah.
yeah, a lot of these things are incorporated when you're training your therapy dog.
So Mona Lisa here has a very, very interesting point, and that was Mona Lisa. That was actually going to be our next topic of conversation. So, and actually the last bit, we have another 5 to 7 minutes. So, your thoughts on clear delineation between how dogs or animals are therapeutic and actual therapy dogs. I think the comfort our dogs bring to us is great. For example, when someone has a dog specifically for a special needs child versus bringing in a dog because they heard that they are helpful. So this, if you remember, this is also something that we were discussing yesterday, and we were discussing,
True.
and we really wanted to talk about. So we do come across situations, right, where people have brought in dogs into their home, where, let's say, they have a special needs child, or they, for any particular reason, saying this dog is being brought into the home to serve a very specific purpose. That is, it's meant to be a dog that is going to provide therapy. But I think there's a clear distinction between the two, right? There's a distinction between a dog in a home, supposedly to act as a therapy, to act, in a therapeutic manner, and going for an animal-assisted therapy session. And can you kind of differentiate between the two for us, please?
Absolutely. And I think this is a very important point. So thanks, Mona Lisa, for that question. It's a very important point because we have a lot of people with, say, happy dogs that call it a therapy dog, and those are not therapy dogs, and that cannot be therapy. And okay, I'll begin with a short case or an example which will help us understand this and delineate this better for us. Now, this is a case from my PhD guide, and he very often uses in a lot of his lectures also, where he says that there was this girl who was in a coma in one of these neuropsychological facilities, and she was in a coma, not responding to anything, anyone, her family members kept visiting, but she was just not getting better. That's when they had an idea, and they realized that she was very, very close to her dog. So why not bring the dog in and try to see if something can be done? And you can imagine how out of the ordinary that situation is for a hospital to allow a dog into that room. And they went ahead and did that. And the minute the dog touched her and licked her, that connection itself, they started seeing tears coming out of the girl's eyes, who was unconscious, who was not in her senses. She wasn't conscious at that time, and there were tears coming out of her eyes. Now, this sounds like a great story. This sounds like something where the dog has been very helpful and therapeutic, but this is not animal assisted therapy, and that's not a therapy dog. Now, we can have a lot of ways in which our pets help us, and we find it to be therapeutic. But if there's somebody who's having some kind of an ailment, or they've been diagnosed with a certain condition, or have a family member with a certain condition, bringing in the dog at that point is not the best solution, because when the dog is brought into your family, it will need some time for it to adjust, like I was mentioning earlier about the rules of your house, about understanding how you want it to respond and react. And when it doesn't do that, it's going to end up making you feel worse, that, oh my God, I got the dog in thinking I will feel better, but this dog is not behaving, it's not responding the way I wanted to respond. And I just end up feeling miserable. So that itself is a huge no-no, that that's not the right time for you to bring in the dog. You need to be genuinely prepared to bring in another family member into your house. Now, that being said, if I am interacting with my dog or my pet at home, that's not therapy. Animal assisted therapy, by its definition itself, is a structured, goal oriented activity that is done by a professional, and not just an interaction of a person with its pet. It has to be conducted by a person who's certified as an animal assisted therapist, a person who knows what they're doing, is conducting a very goal oriented, goals depending on your symptoms or ailments, a goal oriented activity which is very, very structured and not happening informally in a place where you are interacting with your pets or say somebody else's pets. So I hope that kind of delineates these two aspects.
Yes, I think it's important to make that differentiation, right? We have a lot of pet parents, we have a lot of dogs, we understand the benefit that they bring to our lives. But here we're talking about it being a very, very, very specific thing, and it's important to understand and appreciate the difference. Now, the other question, I think, and this is really going to be the last part of our conversation today, can you tell us two things that I want to know? One is that what is, how do I become an animal assisted therapist? One. The second is, and can you also tell us about the courses that you are running? You are running a couple of courses, one which at Christ, and the other international collaboration that you were telling me about earlier.
Exactly.
So we'd like to know a little bit about that. And so let's start there, and we'll
Okay.
move from there.
So a huge misconception that we found is that people, to get themselves certified as animal assisted therapists, require some kind of healthcare or psychology background. So that's not completely a necessity. You can incorporate animals. You can become an animal assisted therapy practitioner and incorporate animal assisted activities. So as long as it's not therapy and you're incorporating animal assisted activities in various places. We have people who come from a marketing background, sales background, work in corporates, even they can get this certification done. So it's not necessary for you to be from a healthcare or psychology background. But if you're providing therapy, then yes, it would ideally be helpful if you have knowledge about the kind of healthcare field that you are working with. So that's the first thing about who can become the animal assisted therapist. Now, how to become it? Unfortunately, in India, we do not have too many places that are offering these certifications or courses. Universities also not so much. There was a course that we ran, the first course, in fact, in India that we ran with Christ University, which concluded by the end of last year. And that was a 6-month training program. However, we are soon coming up with a 1-month training program that will be provided through Christ University. And there's also another program that is in collaboration with 3 of our collaborators from Switzerland, from England, and Canada. They are on board with us as education partners, and they are so we want to truly keep the content at par with international standards. Since we very unfortunately do not have any significant regulatory bodies in India, we are resorting to international standards, and we've brought on educational partners from there. And it's a 1-month training program which offers both weekday and weekend batches. And they can find the information easily on the Therapeutic Paws website for this particular training. And also the kind of key feature here is that it's an online program while the lockdown is there, but after the lockdown is lifted and travel restrictions are lifted, they can avail on-field training and practice as well, which we're offering in Bangalore, Pune, and Delhi.
Okay, so I have a quick question. How can people reach out to you, Unnati?
They can go to the page Therapeutic Paws. I think it's already tagged in the section here, and the phone number, email address, everything is given right there. Even if they head to the website, that is therapeuticpaws.in, they will be able to find the contact us section, and all the information is right there.
I have one final question for you. Is it required that for me to become an animal assisted therapist, I need to have a dog that is going to be a therapy dog? You've answered this already, but then just to tell everybody that you don't really.
No, absolutely not. If you want to get certified as an animal assisted therapist, you do not require to even own an animal. Forget owning a therapy animal. You don't need to have a dog at home. A lot of our work also happens with collaboration with pet parents who've got their pets trained and certified as therapy animals. And depending on where these sessions are conducted or where the requirements are, we incorporate those animals from those places where we've trained and evaluated them. So personally, you do not need to own a dog to become an animal assisted therapist.
That's awesome, Unnati. Such an interesting topic. So much that you have told us. I mean, I'm really, really glad that we got you on board and that we were able to talk today. We are at time. We're a few minutes over time, so we're going to stop the broadcast, end the broadcast in now. But thank you so much. Thanks to all the viewers, all the users who've come on, all the questions, and thank you so much, Unnati, from DogSpot and from me for being here today.
Thank you so much, Preeti, for having me. Thank you.